Good morning, I'm Dr. Jacelyn from DentistChannel.Online. Here with us we have Dr. Mayur. Kindly introduce yourself, sir.
Good morning. Good morning, Jacelyn. So I'm Dr. Mayur Khairnar. I am placed in Mumbai, and my majority of the practice is based on immediate functional loading. Majorly my cases are with the full mouth implant reconstruction, and these are those cases who are underprivileged because of the severe jawbone atrophy. They don't have bone and they're left out with no other options other than living like a normal, compromised life. So these are those cases which are done with the immediate loading protocols. We do a graftless solution to them, and we change. Our practice is basically based on improving their quality of life. With my experience, I have placed more than 25,000 dental implants in my practice, and I have been training doctors all over the world for this particular technique of immediate loading with a graftless solution.
That's amazing, sir.
Thank you.
So what is the scope and future of immediate dental implant loading?
Well, coming to the scope, everyone, whenever there is a possibility, when we think about dental implants, we get a picture in our mind like dental implant means two missing teeth are there and we are placing an implant, but actually that's not real indications for the dental implant. To be honest, the real indications are those cases where the teeth are missing on the back sides and there is a resorbed bone because of the sinus lifts and requiring a sinus lifts. So these are certainly the cases where the patient needs fixed teeth with the help of dental implant. Because of the severe jawbone atrophy, needing some extensive procedures like sinus lift, bone grafting, patients are always underprivileged for getting a fixed teeth, and that too it takes huge amount of time. So if we see and the patient is having less jawbone, they have at the same time very less time. And the patient who have abundant bone, that's a common thing. They have a pretty good time, but they don't have a good expense to share, to spend on themselves. So it's better if we change our focus and we upgrade our skills, so we can be in a situation to learn all the cases done with the immediate loading. Now there are certain cases where the bone is very, very thin. Even in such cases, it is possible to do the immediate loading with the help of immediate loading protocols. Okay, so in short, the immediate loading, if an orthopedician can make their patient walk in just 3 to 5 days, then why can't we, as a dentist, make our patient achieve good food like burger or anything in just 3 to 5 days? So it's possible.
Okay, so like in majority of your cases, can you use these implants?
Yes, 100%. So if we see in majority of the cases, the implants can be used, especially when there is jawbone is very, very atrophied. I especially use special design of implants, which are the implants from Quick Dent implants. If you see, these implants are specifically meant for placing into the areas where the bone is atrophied. Okay, if we see a standard design of implant, we have to do bone grafting to modify this bone so that this implant will be suitably placed into the jawbone. And but whereas these designs are especially these designs where they are modified, the designs are modified to suit the resorb bone. So especially the implant which we use in our practice is a Quick Dent dental implants. So they have a wide range of single piece and 2-piece implants, and with this particular designs, almost all type of cases can be done. Yes.
Okay, so you just told about resorbed jawbone. Can you throw a little more light about how these implants work and how you place them and all of this?
Okay, see, we have a range of implant designs with the Quick Dent implant system. The first design is a F.I.O.C.I. The implant is F.I.O.C.I. and here it can be used in very soft bone cases with one single osteotomy. You can directly place the implant. So even if the bone is very soft, we can get an excellent bone condensations. So that's the first advantage of the F.I.O.C.I. implants. The second is the cortical TPR, especially in the cases where the bone is resorbed, as well as because of the perio infections. A lot of perio infected tissues are there. So these designs are perfectly suitable because they have a crystal polished collar, and with one single drill you can just go and engage the implants into the second cortical bone. The second cortical bone is nothing but the basal bone. Moment you engage the second cortical bone, you get a very excellent torque, and because of that, any individual can get, especially a dentist can get a very good torque, and he can do the immediate loading. So these are the two important design. Well, there's a simple technique. This works like a bone expansion screws, where once you do one single drill, the bone gets expanded by its own. and every cases can be done very easily.
Can you share with us some of the challenging cases that you have come across?
Yes, so we keep doing regularly challenging cases, especially one of the case which I remember, a patient gentleman came from UK and he was having absolutely no bone, and even if the CBCT scans and the x-rays were absolutely showing very thin bone. So we decided to restore his case with the pterygoid implant, zygomatic implant, the nasal implants, we also call it canine buttress implant. Now these are the new approaches for immediate loading. In the lower jaw, the bone was also very resorbed, where we had to do a nerve bypass procedure, and in the intermental foramen we placed this implant. The implant which I preferred in this case was a cortical TPR implant from QuickDent, and we had a 2 years follow-up for this gentleman, and absolutely his confidence was superb after the treatment and he was very happy. So we have done pretty good number of cases like this on a regular basis, and we have changed people's life. Yes.
So can you throw some light about cortical implants? What are cortical implants?
The cortical implants are also, they have different names. You can also call them single piece implants, you can also call them basal implants. Well, cortical implants come also in 2 piece, but if we comes to single piece, there are certain specific indications for single piece implants. The single piece implants are to be used only in elderly patients, where they don't have to go on an extensive procedures like zygomatic implants, because the basal implants or the single piece implants can be used to avoid zygomatic implants. So any patient who is having a medically compromised health, for them this is an ideal suitable situation. Well, the one disadvantage of single piece implants is the prosthesis is not retrievable. That's why I always recommend it to be used in the elder patients with a good proper training, so that these patients can stay with this teeth for whole remaining life.
Yes, sir. That's amazing, sir.
Thank
Can you show us some of the extremely difficult cases that you've done with QuickDent?
Surely. So for example, recently after COVID-19, there has been a lot of cases of black fungus. So if you remember, so black fungus patients were literally left out with half of the life, like half of the jaw was been removed and their life was totally compromised. So one patient who came across me was basically a priest, and his profession was based on speaking mantras and Vedas and all these things, and he came to me and said that I want to suicide. I said, why? Because I have faced this problem that the whole of my jaw has been taken out. Now what I can do? So I said, no, don't worry. This is a common thing which patients with such kind of problems comes to us and tell. So we always take care of this. We restored his case with the help of a zygomatic implant, pterygoid implant from QuickDent, and we gave him a perfect prosthesis which was like similar to his own natural teeth, and he could speak well, he could come back to his own original life, and he is almost having more than 2 years of follow-up now, and he's enjoying, and every time he sent me a good text message saying that, doctor, you have changed my life. So it's always good to work not on just placing implant, but to work on changing people's quality of life.
Sir, we're really inspired. And
thank you.
How can we learn these kind of crafts? Where do we learn them from?
So see, it's very simple. One day I was also somewhere where I was sitting in an audience and I was thinking how I can learn this. So it's very easy. During our time, we used to go to different countries to get the different recipes from different speakers or different trainers, but today we are in a situation to deliver this thing to you. So we keep conducting the workshops on regular basis in Mumbai, where a lot of doctors from all over the world comes to us to learn this particular recipe, and they are also doing it. So if you can see, a lot of my students are also placing now zygomatic implants, pterygoid implants, nasal implants, nerve bypass. They're treating all the resolved cases in just 3 to 5 days period of time. So it's possible. If you have a determination, if you have a will, definitely you can find the way, and you can change people's life.
So what is one message or your 5 tips that you would like to give it to the audience?
Surely. So the most important thing is that you should understand the patient never comes to us for implants. Patient comes to us for a beautiful smile, a beautiful life, a new teeth by which he can chew effectively, and he can, in the social life, he can confidently interact with his friends, families, relatives, everyone. But that's the most important thing you should understand. So No, patient never comes to you for the teeth. So my message to all of you is that work good, work hard, learn good things, and deliver a beautiful outcome to the patient, so that patient will give you a lot of blessing. At the same time, the money is always a byproduct. Never think about the money. Just think about the patient's good quality of life. It will flow in your life, and I'm sure your practice will amplify by more than 10 times, and you're going to get something amazing. That is the blessing, because it's easy. My forefather always say that it's a good thing to give someone eat, but it is far more better if you make someone capable of eating. And that's what we as a dentist, we doing it. So we are a dentist, we are a scientist, we are an artist, and we should be proud of ourselves that we have that scope of treating patients in this way.
Thank you, sir, for joining us
Thank you
today.
so much.